Hey, it's Manny for the Dermatology Laser Center of Studio City. As you can see, it's right behind me. And my man, Dr. Rubenstein, has sent me off to the streets to find out what people have on their face, on their skin, whatever it is. No topic is off limits. I'm telling you right now, we're going to find out what kind of questions they have about their skin. This is Real Skin.
You're watching Real Skin. I'm Dr. Rubenstein, and this is where we talk to real people about real skin issues.
What kind of questions do you have for Dr. Rubenstein?
I have breakouts around my nose, chin, and forehead, and I use Proactive, but they never go away. So how do I get rid of it?
I get a lot of patients who come to me with a specific type of acne. It's actually not acne. It's actually perioral dermatitis, but they think it's acne. It's pimples that occur around the mouth, on the chin, around the temples. They're tiny little pimples, and they also get some redness on the face. Oftentimes they have treated this disorder with acne treatments like benzoyl peroxide, salicylic acid, and other acne medications, but it has not cleared. That's because it's not true acne. It's something called perioral dermatitis, which is more related to rosacea. It's also exacerbated or made worse by the same types of factors as rosacea, like caffeine, chocolate, heavy exercise, sun, wind, and other factors that rosacea responds to, like wine, red wine. We treat this in much the same way that rosacea is treated: pills, oral medication or pills, and also by using topical medications or creams. Sometimes laser treatment is also indicated for this, but usually responds extremely well to medications within 1 month.
Hey doc, is it good to pop a whitehead?
Ew!
Popping pimples in general is not recommended. When you pop a pimple, you could actually push the bacteria back into the skin and cause a worsening of the problem. Oftentimes people ask me about popping pimples, and I tell them that they should go to either a qualified esthetician or come to a dermatologist, have the dermatologist take a look at the skin. Depending on what type of pimple, we can do certain things to the pimple. For example, we can inject pimples at times. Injection with a special medicine that actually helps to bring down the pimple quickly, as opposed to irritating the pimple and making it actually last longer. In addition, a lot of patients pop pimples and cause worsening of their acne as well.
My dad had a friend who had acne scarring on his face, and he did a lot to prevent it, but it still happened. I didn't do anything to prevent my acne, but my acne went away and I don't have any scarring. So what's the main cause, and how can you prevent scarring for the long term on your face from acne? I
really talk to my patients about two types of acne: more superficial acne and more deep acne. The superficial acne is non-inflamed, and the deep acne has a lot of redness and inflammation. It's the deep acne that can become scarring. For the superficial acne, we tend to use creams. For the deeper acne, we tend to use oral medications or other systemic medications or even lasers. Deep acne can be scarring. So a lot of the times when people get acne scars, it's the type of acne that causes the bumps in the skin that can actually cause scars to happen. And a lot of the patients ask, why should I treat my acne when I know that the acne is going to go away someday and then I won't have to worry about it? But the truth is that if the acne is deep enough, it causes scarring that's lifelong. And so it's really important to treat it, oftentimes aggressively. I even have a lot of patients who are hesitant to go on systemic medications such as antibiotics because they're worried about the side effects of the antibiotics, and that is understandable. But it's also important for them to treat the acne aggressively and to prevent the scars that they'll have the rest of their lives.
Right here at the corner of Laurel Canyon Boulevard and Ventura Boulevard, right near Dr. Rubenstein's offices at the Dermatology Laser Center of Studio City. And if you guys want your questions answered, log on to laskinmd.com or go to the YouTube page, which is youtube.com/realskin. All right, I'm Manny Streets. I'm out.